Hello. Thanks for meeting with us. So we just have a few questions that Dr. K, because we're both GAs, so Dr. K asked us to interview you and get your perspective as an SLP-D student, as well as owning your own private practice, and just some advice for us as graduate students. So we just have a few
Sure.
questions. It should go pretty smooth, pretty quick. But so our first question is, how has your perspective on the field of speech-language pathology changed since beginning your doctoral studies?
Oh, wow. Okay. Since beginning my doctoral studies, a lot has changed. My view of evidence-based practice as a whole has changed. I think before starting my doctoral studies, I thought about evidence-based practice as quantitative research. And now I see that qualitative research is a very thriving, valid, really fascinating area of our field. There's a lot of empirical data coming out of qualitative research, and also our lived experience as clinicians and our clients' preferences also weigh into evidence-based practice. So, what I believed constituted 100% of evidence-based practice actually ends up constituting about 17% of evidence-based practice if we were just to look at numbers from quantitative research.
Thank you. Our next question is, what advice would you give to a current or future graduate student about balancing coursework, clinic, and personal life?
Well, keep in mind that if you if you have listened to the family and addressed their primary concerns and set a plan with them at the end of the session, then it's going to be okay. Like, even if you didn't have the session you were expecting, even if you didn't accomplish as much as you were hoping to accomplish, or the kid ended up crying for over half the session, it's okay. No one died. You didn't hurt anyone or anything. And if you've also supported the child or the family or the patient that you happen to be working with, then that's still a win.
Yeah, I feel like a lot of the times in grad school right now, I think we're striving so hard to be like perfect in like our the way we approach, preparing for sessions or like even us going into our school placement in 2 weeks, like wanting to make sure everything is perfect. But you're right, like at the end of the day, as long as the family feels good and, the child is okay, then that's what we need to focus on. Thank you. Okay.
Yeah, change doesn't happen overnight, at least not usually. I mean, occasionally you might have that golden session where the child learns an R in like 1 week, but those are very unusual. You want them to walk away feeling good and capable.
Definitely.
Yeah. And I think the point you also made is just so important when even looking for the intervention strategy to try with a child, because there's so many different options. So trial and error might work best with one child when one specific approach worked with the same situation the week before. So definitely working with the family, their goals, the child's goals too. So that's a really important point, especially when making those critical decisions. I feel like that we're most nervous about when starting to do our own intervention, like on our own without a clinical instructor too. So.
Yeah, you are just, when you graduate with your master's degree, this is something I didn't really understand. But when I was just graduating, I thought I knew everything. But the fact is, you graduate with enough tools to make you dangerous, and then you get out there, and that's when you start learning. Your learning will start the moment that you graduate with your master's degree. And you will always, always, always be learning. 15, 20, 40 years down the road, you will always be learning. And some sessions are not going to go the way that you plan. Those are not failures, they are opportunities to learn. So reflective practice is a really important part of the work that you do as you reflect on what went well in a session and what didn't go so well. Sometimes maybe even journaling that out might be really great as you reflect on what didn't go the way you were expecting and what you want to do better at next time.
Yeah, definitely. I feel like even with my CI in our first clinical placement, she told me she's been working like in the adult setting for 8 years now, 8 or 10 years. But she said after the fifth year, she went into work and was like, yeah, I think I got this today. And she said a lot of it was that trial and error and reflecting exactly like you said in the beginning, because it's not going to be perfect, but being able to work in a team, like an interdisciplinary team with everyone else around you and know that people do want to help answer your questions, even if you think it's something silly. So, yeah, I think that's really important too.
Mhm. That interdisciplinary piece is huge. Like, we are not a lone little island as speech therapists. All the people that we work with are extremely knowledgeable in their different areas, and you have to rely on them for their knowledge to be a good speech therapist. The OTs that you work with, ask them tons of questions, and the teachers ask them tons of questions, and the doctors and the nurses, like, ask them all so many questions because it's going to make you a better clinician, even within your own scope of practice.
Right. Well, pivoting off of that, in what ways have you seen working with interdisciplinary teams enhance your practice?
It's essential. I can't do any of what I do without interdisciplinary work, and that includes the parents of the children that I work with or the caregivers of the adults that I work with. So this is all very interdisciplinary, but we can't work um, we can't work isolated. We have to work in collaboration with others because well, not only are our lives like a web of interconnectedness, but our clients' lives are webs of interconnectedness too. And so if we're trying to go in without involving any of the people who are vital parts of their web, we're not going to be successful.
Definitely. Definitely. I feel like that's something even in my clinical placement over this past summer was seeing how involved like we truly are with like families and their perspectives and how we can aid in like taking those strategies that we teach in our sessions, but then also ensure that families are able to do that at home while working with OT, while working with PT, because I was an outpatient for pediatrics this summer. So it was very
Mhm.
interesting to see all the perspectives like work together as a team to enhance that child's success or that person you're working with success. So definitely. Okay.
In my first clinical placement in graduate school, I walked into a skilled nursing facility room with this guy who had some major edema issues going on in certain parts of his body, and I was having a really hard time engaging with him that day. And if I just talked to the OT and the PT or the director of nursing or anyone, I would have figured out, I would have been told, oh, watch out, because so and so is dealing with XYZ. It's all related to the fluid buildup but I didn't. So that interdisciplinary piece is really huge, even to the point of making or breaking your session that day.
Yeah, that's such an important point. And I feel like a lot of times I really like how our program really talks a lot about the interdisciplinary approach and how important it is, and a lot of research that we do in like PBL, our problem-based learning, goes into questions about that. And there's just been like I've had weeks where I've researched that for different settings, like school settings, outpatient, like you were saying, adult, child situations or populations. And like the research goes to show it's so important to be able to have that like holistic perspective on your patient at home and with the other um, care providers that are seeing them throughout the day. It really does, like you said, like make or break the session that you have with them and even the way that they go about their own intervention and their goals and everything. So it's really an important part. So um our next question is, what business or leadership skills do you think SLPs should learn if they're considering private practice?
Well, business or leadership skills. Understanding the different roles within your organization, if we're going to be talking business here, is really important. Let's say that you join a practice with occupational therapists, administration, speech therapists, etc. If you don't understand what exactly the administrators are doing, or the controller is doing, or the insurance billers are doing, go and talk with them about their jobs because it all relates directly to your job. You might get really frustrated thinking, oh, there's no financial transparency within our organization, and I don't know how much we're bringing in as a whole versus how much comes into my paycheck, or why am I only getting paid this much out of the total amount that's brought in by insurance? But you don't see the overhead costs, you don't see the time that goes into some of those administrative tasks or for billing. So it's really important to understand all the different pieces within the organization, regardless of whether it's your organization or not. The same goes for school districts. Understand how much money is going into dispute resolution costs, or sit down with a special education director and talk to them about their job, just so that you understand better what you're really up against as a clinician and how you can make the most impact within your organization.
That's
Thank you.
yeah, I feel like that's so great because and something that's important to remember as like potential, like, well, wait, what am I trying to say? That's so great to remember as like going into like maybe a private practice or just any organization that we work with, like really trying to understand what the back end of it because we want to be able to be fully competent and aware of like who we're working for or everything in regards to that, especially when it comes to insurance purposes and billing. I feel like that's something that we're learning a little bit now in grad school, but I'm really excited to see like as we go further throughout our placements, like how that all works. Because even in Simucase, we try to do it, but it's like it's kind of confusing right now. So I'm looking forward to being able to like truly like understand how billing works with different insurance companies and ensuring that our clients are, being set up the best way possible and it's being done the right way. So definitely.
Yeah, it's going to benefit your clients or your patients as well because they're going to have a lot of questions that are outside of your scope of practice. It's good to know who you can direct them to, or just to have a fundamental idea of the workings of whatever questions they happen to ask you about billing or insurance or whatnot, so you can give them some preliminary answers before directing them to the right people who can help them. A big, big part of our job is connecting people to the right resources or the right people within or outside of your organization. Sometimes we're the first line of defense. We might be the very first phone call from a parent of a child who's exhibiting language delay at 18 months, and we could end up being the first provider in a series of dozens or even 100 providers over the course of their life. And so you want to set a good precedent and help them to get to the right place, even if it doesn't end up being speech therapy.
Definitely. Thank you. So, our other question that we had, oh, can you hear me?
I
Sorry.
think we're frozen.
I don't know if we're all.
You guys are frozen. Can you hear me? See?
Hmm.
Okay. Just being sure.
Yes.
Okay. So, what was the biggest challenge you faced when opening your private practice, and how did you overcome this hurdle?
There were a couple of big issues. The first was lack of knowledge, just because we don't receive business training when we're in graduate school. And so trying to understand who to talk to about, well, anything really, not knowing where to start. It's hard to know what you don't know about what you don't know, right? And I wish that someone had told me, go talk to someone who's doing something similar to what you want to be doing, and then just ask them questions about getting started so you don't have to reinvent the wheel and make a billion mistakes along the way. And I apologize. What was the other question
Oh,
that you
that was good.
asked?
It was just saying, what is the biggest hurdle that you felt like you faced when first starting to
Oh,
open up your practice?
yes, yes, yes. The other one was imposter syndrome. So we think, I'm just me. I'm not that great. I'm just this like tiny little person over here, and I don't actually know that much. But the issue is, we actually do know a lot. We know way more than we think we do. And we have this incredible skill set that is able to help a ton of people. Even things that you think a lot of people already intuitively know, oftentimes they don't. Or they might be looking for someone who's just going to love them and care about them and listen because their circles in life are so small. So, not discounting your abilities and selling yourself short is really great. Not undercharging for services is really important. I see that happen all the time. People who are massively undercharging, who should be doubling or even tripling their hourly rates because it's ridiculous. They're not doing anybody any good by charging as little as they are.
Right. Thank you. I feel like imposter syndrome is something, even now, like as graduate students, we're facing. So it's something that we're all trying to push through. I think, as hopefully my hope is that as I grow into a clinician and I'm able to use my skill set, whatever direction I feel in 15 years I want to go to, maybe if I want to open up my own private practice, that I can, remind myself like, my worth as a clinician, and going back to what you said in terms of like, like taking it day by day, but knowing that you are qualified to be in that role and open up your own practice. I feel like that was great. So thank you for that
Well,
insight.
Yeah, I
totally. No, it was really important to point out that this is something that you're already experiencing as a graduate student, like sitting across the table from a client, you're like, what am I doing here?
Yes, definitely. Definitely.
Yeah, I
Melanie, I'm
really,
so sorry.
no, it's okay. Don't worry. Yeah, I think that what Jamie said is how like a lot of us feel. And I think that some of those days when I do have imposter syndrome, I look around and I'm like, okay, but I'm here. And a year ago from today, I didn't know if I was going to be here. So it's like keeping yourself grounded and motivated that it is all going to work out no matter which like route you take at the end of grad school. And I just want to like know, I feel like whenever I have that, I talk to you about like anything about speech and our practice, it's just really inspirational how much you've like worked to create this for yourself and like being able to talk to us about it. And I know that our classmates, when we had the opportunity to do that meeting with you, they all were like, maybe I should do I can open a private practice too. So it is like, it's really awesome and cool for us to have an inspirational figure that's like can talk to us about this stuff and tell us that we can figure out really anything if we want to and get clicking on our computer, like how to open a private practice and, having
Yeah.
that sort of mentorship. I just wanted to say thanks for sharing that with us. And it's really
Oh,
inspirational.
if you were not capable, you would not be in graduate school right now. Getting a master's degree in speech therapy has to be one of the absolute hardest things in the entire universe. It is so hard. I can't count the number of times I cried in my master's program when I was in there because it was so grueling. I mean, the number of requirements and the never-ending list of to-dos, and the fact that you're in a room alone with a kid and you're so worried because you don't know what you're doing, and there's a clinician watching you who's writing down everything you're doing wrong. It is so nerve-wracking. But like, you wouldn't be here if you weren't capable. We have all of these boxes that we're put into in life that we think we can't ever escape from, but you can literally do anything you want to do. If you want to go and start a private practice, do that. If you want to start a nonprofit, do that. If you want to move permanently to Tahiti and work as a remote SLP and then go and live out of a van just traveling around the world, go do that. You can do anything.
Thank
Definitely. I thank you, yeah, so much because I feel like I do feel like the other day when we had the meeting with all of you guys and you guys told us all your perspective and insight, like seeing like full like practicing clinicians and each in your own how much you each love what you do is so like inspiring for us as grad students, because I think it's so easy for us to get caught in like the turmoil of being like, okay, I have this final thing to do and then I have this to do and it's like what like it works out like it's just 2 years. Learning is forever, but the to-do list, while it doesn't always necessarily end, I feel like it does give hope to us seeing you guys being such inspirational people and you're such yeah, it's actually amazing to see this and for us to be able to do this because it gets hard, as you know, but it's hard. So it's really great to be able to talk to you and um I don't know, just get some inspiration and to push us through this program. So I appreciate that.
It's Oh yeah, it's hard, but you guys can do hard things. You will always have hard things in your life, and you will always have a to-do list that's a million miles long. But you can still carve out time for different things or new things and prioritize what it is that you want to prioritize. You can be a clinician and a private practice owner and a mother. Or you can keep a house running and be the primary breadwinner and go and have like a really happy friend's life or a thriving hobby on the side. Like you have the ability to do quite a lot if you understand just how capable you are, which
Definitely.
is a lot.
Definitely. Thank you. Well, I think we should just wrap it up. We had one more question, but I don't know if we're gonna have enough time. So we'll ask it and then if we I don't want us to run out of time in the Zoom to end. So but we'll just ask it. So what research are you currently doing and how does this research impact your practice?
I'm researching, well, I think the best way to look at it is by calling it family professional partnership. So the relationships between families and the school districts that they engage with and trying to rebuild trust, repair damage that's been done. They're good people on both sides, but sometimes through lack of understanding, those relationships can be a little bit damaged. And so there's a lot of really great research that's being done in this area of the family professional partnership right now.
Thank you. Well, thank
Thank
you
you.
so much for meeting with us. This was wonderful, and we appreciate you working with us and switching the date from the original date and all the Zoom links. But we really appreciate it, and we look forward to hearing from you soon and as we go through this program. And so we just thank you so much.
Yeah, thank you so
Thank
much for
you.
all this insight. It was really great.
Yeah, you guys are busy too. Thank you.
Thank